Hello, my dear aspirants. Welcome you all to the Master Nursing classes. So many of you are asking for the important topics for the Norcet exams and RRB exams. So what I'm giving you a complete important topics today is not going to help only for the Norcet 8. So it will be going to helpful for all the Norcet 8 and Norcet 9 and all upcoming exams plus RRB exams and all kind of the state and central government exams. Because these are the very hot topics where the examiner repeatedly interested and clinically competent topics. So where the topics and things are clinically competent, then only the examiner will throw the question in front of you all. So we will discuss those important points and important topics where the examiner is much interested. So this particular content what I am giving here is completely based on the previous question paper analysis. So I have analyzed all the Norcet question papers and all other important state and central government exams question paper, and where the as output I got of very few topics where the examiner is repeatedly asking the questions. For example, in the last 4 to 5 Norcet exams, there is repeatedly examiner asked the question on the bacterial vaginosis, bacterial vaginitis, and all sexually transmitted diseases questions. And I have seen the other questions paper where the research methodology continuously questions will coming like what is the retrospective study, what is the prospective study. Okay, so these questions. So where the students are making the mistake and they are not revising and going in the exams and getting confusion. So this is the very important hot topics all you people have must and should revise before going to the exams. So I will teach and give a note to you people or take a screenshot of this particular concept what I am telling today. Otherwise make a note of this one, and so daily on the daily basis keep a task for this ones. Okay, at least 5 to 6 topics what I'm giving today you people going to cover, so that is definitely going to decide your rank in your exams. Okay, so most importantly, so as I told, whatever the things giving today is based on the previous my particular experience plus the all analysis of the previous question papers. Okay, so where repeatedly questions are coming, all people don't have to leave that particular questions and concept. So without wasting the time, we will start the today's session. So in this one, first I'm going to deal you, so what are the things which are repeatedly striking from the psychiatry. Okay, from the psychiatry the things repeatedly striking is terminologies. So in the terminologies, the examiner repeatedly interested to ask the questions like the patient is not able to initiate the activities. So what we call that one. Okay, so the patient is like responding to the situations where there is no external stimuli. What we call that one, like hallucination, illusion. Okay, so these kind of the terminologies are repeatedly asking in the questions. So there are 40 to 50 terminologies which is given in the all competitive examination exam book. So please must revise this one. So from this one at least 2 to 3 questions you people will get definitely terminologies of the psychiatry. Okay, so after that, what is most important in the psychiatry? So that is the schizophrenia. From the schizophrenia, in every year question paper there is one question that may include the types of the schizophrenia, negative symptoms of the schizophrenia, positive symptoms of this schizophrenia. Okay, Kurtz-Snyder first rank symptoms of this schizophrenia, or else the types of the schizophrenia and the management of the schizophrenia. Repeatedly, there is fixed one question which is coming from the our schizophrenia topic in all the exams. Okay, most importantly, along with that, a few times he asked the history of the schizophrenia, like one time, who discovered the schizophrenia? There is a Emil Kraepelin, sorry, what you can say, Eugen Bleuler, and who said the schizophrenia as a this one dementia precox. 2 times asked questions where like Emil Kraepelin will be our answer. So the history also most importantly, and I have covered this one already in our psychiatric crash course session, so which is available free in the my YouTube channel only. Please visit to the Play Store where you will be getting the 8 to 9 videos on the psychiatry for the duration of the 2 hours. Okay, so for each video is for the 2 hours and 1 hour, so that is most important where I have covered the all important topic for you all. Okay, so if you want, watch those videos also. That is going to helpful for you all. Okay, so in every exams, the question is coming on the antipsychotic medications. So from the antipsychotic medications, the exam is very repeatedly asking the questions on the atypical also, where the he will ask the question on the clozapine, and most importantly, typical antipsychotics, he is interested to ask the questions on the extrapyramidal symptoms repeatedly. So please do revise these extrapyramidal symptoms before going to the exam. So this will definitely give you a one question here. Okay, so most important. Then what you have to study, sir? There is the antidepressant medicines. In the antidepressants medicines also repeatedly questions is coming. Okay, as a drug of choice and all, and management. Okay, so that is most important, right? So in the anti depressants you are studying means you have to study here as a mood disorders also. Both depression and mania is important. Repeatedly questions coming on this one. Where the depression related to the suicide risk, and in the mania related to the harmfulness towards the patient self or towards the patient others in the hospital. Okay, so those kind of the questions throwing repeatedly in the mood disorders from the depression and mania. So from the antidepressants also it's most important. Okay, as I told, in the mania we are going to give a mood stabilizers, that is the lithium. Lithium is a most important. Okay, so I will highlight here with a red pen. So these points, questions, you people never ever should avoid. Okay, terminology compulsory we have to study, lithium compulsory we have to study, and antipsychotic medicines, extrapyramidal symptoms compulsory how to study. If you want to avoid the other thing, but wherever I am making this question signal like this one, so this is compulsory. Okay, don't avoid these things. So schizophrenia, I am also telling that a fixed question is coming. So do cover this one also. And this one compulsory. What I'm red highlighting, that is the compulsory one. Okay. So the next one is the ECT, electroconvulsive therapy. Compulsory. Compulsory. ECT is compulsory. So here he can ask the questions on the medications which are we are giving before the ECT. That may be a muscle relaxant anesthetic. And so he may ask the questions on the lead placement and duration of the ECT and post procedure ECT care. So that is most going to important, and definitely one question is striking from the ECT also, right? So then most important next one is the sexual disorder terminologies. Sexual disorders terminologies, where the repeatedly questions came. What is the pedophilia, zoophilia, okay, voyeurism, okay, proturism. So these kind of the questions on the sexual disorders. So repeatedly questions are strike in the exams, but you don't neglect this one. Must revise. Must revise. Okay, sexual disorders. So definitely one questions will strike. From 10 to 15 terminologies are there in the sexual disorders. Please revise this one. Okay. So the next one is the uh, therapeutic communication techniques and impasses. This one, I know all of you people will avoid this one. Therapeutic techniques, therapeutic communication techniques. Therapeutic communication techniques and its impasses. So what this one, sir, I am not getting, sir. Don't worry, I will tell. Bacha, repeatedly questions asked in the all last three Norcet related to therapeutic communications. That is most importantly techniques, where the questions related to the reflection, the questions related to the regression, and some techniques. And most importantly, in the last Norcet only, many questions came from the therapeutic technique impasses. That is the transference, counter transference, and resistance. Okay. So from here, the questions repeatedly striking transference, counter transference, and the resistance. So if you want to avoid the techniques, but definitely study the therapeutic communication impulses. That is the what is the meaning by transference, what is the meaning by counter transference, and what is the meaning by resistance. So it is very important for everyone. Okay. So the next one is the yes psychiatric emergency conditions where you have to study the compulsory suicide and its management. Okay. So this is also important for your upcoming Norcet exams. And so this one you have to revise mental status examination plus mini mental status examination plus neurological examination. So from all these three, definitely two questions will strike. Okay, so it's important. Last time also one question came from the mental status examinations and mini mental status examination. Like the nurse is asking the time, duration, okay, sorry, time, place, person to the patient and what she is going to assess actually. She is going to assess actually the orientation. So orientation is a part of the our mental status examination. So from here the questions will be coming like this. Okay. So mental stress examination, mini mental stress examination. Then most importantly, the neurological examination where the cranial nerve examination is most important. All cranial nerves you people should and must know and its examination. Which nerve is responsible for shrugging the shoulder? Okay. Which one is responsible for turning the head right, left? Okay. Which is nerve responsible for the corneal reflex? So these kind of the questions they will throw repeatedly. Okay. So it's most important. This is the important from the psychiatry. Let me quickly revise that one. So what you have to study? All terminologies quickly revise. Schizophrenia quickly revise. Antipsychotic medications, especially extrapyramidal symptoms, revise quickly. Antidepressants, revise quickly. Lithium, most important. Then ECT, sexual disorder terminologies, and therapeutic communication and impulses. So this is most important. All you people have to revise. And psychiatric emergencies where we have to revise the suicide and mental stress examination, mini mental stress examination, neurological examination. So these are most importantly how to must revise from the psychiatric nursing. So then I will come for the fundamental of nursing. So from here, the questions are repeatedly striking from the nursing procedures. It may include thoracosynthesis, positions repeatedly asked in the thoracosynthesis. Then comes to the lumbar puncture. Lumbar puncture procedure. Here, fixed question. Lumbar puncture compulsory how to revise. Here you have to the questions will be like where we have to insert the needles in the children's, in the adults, what is the post lumbar puncture headache, how we have to manage the post lumbar puncture headache. Okay, so these kinds of the questions repeatedly striking from the fundamental of the nursing. Okay, very important lumbar puncture. I am telling repeatedly. So then comes to the chest tube drainage. In the chest tube drainage, bacho, they will ask the questions like the articulation is absent, what we have to do, the articulation is present, whether it is normal or abnormal. Okay, so when the tube like comes out of this chest, what we have to do. Okay, so when tube disconnects from the chest tube drainage, what we have to do. These kinds of the practical baseline scenario based questions will comes from the chest tube drainage. So these are already discussed in my YouTube channel in the important questions of the nonsense. So please do watch that one. So it will give a clear idea for you all. Okay. So the chest tube drainage is most important. So then comes to the again next important points. There is the suctioning. Okay. But this suctioning alone is weighted for the 3 marks. Okay, so it is this particular only one single particular concept may comes with the 3 marks, which because in the last Norcet it is asked for the 5 questions, including the mains and prelims. So suctioning and its procedure: what is the closed suctioning? What is the open suctioning? What is the suction pressures? what is the pressure in the adult, children, okay, neonates. So it will repeatedly questions will come. Most importantly, suctioning procedure, all you people have to revise and study completely. Then tracheostomy care and ut care, central line care. Okay, tracheostomy care, ut care, then most importantly, yes, central line care. So these cares, like when we have to change the dressing from the tracheostomy, when we have to change the dressing from the ET2, okay, then central line dressing with the tragadram, when we have to change with gauze pad, when we have to change. So these questions, this type of the questions may comes from these particular topics. Okay, so then comes to the most important and next one is the oxygen therapy. From the oxygen therapy, the questions may comes from the devices. There's an image based question. One thing. Then next, they will ask for the, so which one is preferred in the COPD? Then which one is the most accurate, okay, most accurate method of the delivery of the oxygen? Which one is the most common method of the delivery of the oxygen? Which is preferred in the anxiety patient? Which is preferred if more than 6 liter per minute you want to deliver? Okay, which one is preferred if you want to deliver less than 6 liter per minute? And which one is the high flow, low accurate? Which one is the low flow, high accurate? So this kind of the questions which will comes in the exams. Okay, and image based questions. Don't forget, bacho, all oxygen devices like simple face mask, nasal catheter, HFNC, ventilator, ventilator circuit. Okay, everything. The oxygen delivery system including the ventilator machine and its functions. People have to know before going to the exam. It's very important. Okay, so oxygen therapy is most important. In this one they will used to ask the questions like this. I have told a beautiful scenario also for you all. Okay, so the next one is the most important one. So that is the airway management. Airway management. Here they will throw questions like what is the airway management in the CPR. Okay, so what is the airway management in the bronchospasm, right? So these kind of the questions will come. Okay, what is the airway management technique to open the airway in the cervical skull? Sorry, the cervical spine fracture. Okay, so what is the airway management priority in the road traffic accident patient? Both here. Yes, which one? Jaw first maneuver is the preferred one, right? So and they will ask the question also mouth to mouth breathing. Okay, so in this one, the airway management and the techniques comes to the jaw thrust maneuver and head lift chin. Head tilt chin lift maneuver. So usually we will do head lift. Sorry, head tilt chin lift maneuver. And in cases of the road traffic accident and in case of the cervical spine injury, we will go for the jaw thrust maneuver. So this one also they can ask the repeatedly ask the question. So most importantly, airway management must revise all the thing. Okay, so here red highlighted one. Okay, so then comes to the next one, the first aid. Here we have to see all the scenarios in the first aid. Okay, especially a Hamlet maneuver where you can say the abdominal thrust also for this maneuver. So from this particular abdominal thrust, there is repeatedly asked for questions. Okay, so important. Then comes to the first aid in case of the epistaxis, nose bleeding. Nose bleeding or epistaxis. What is the first aid? Repeatedly asked for questions. And here we have to also need to cover the advanced cardiac life support and basic life support and advanced trauma life support. So from this ACLS itself, Two questions may come. BLS itself, two questions may come, and ATLS itself, two questions may come. So this one is must revise. Must revise. ACLS, BLS, and ATLS. So advanced cardiac life support, basic life support, advanced trauma life support. Bacho, I am telling it is very important. So one topic alone can weightage for the at least 2 to 3 questions. Very important. Don't neglect this one. So then comes to the ABC analysis. Fixed question. Arterial blood gas. Fix 1 to 2 questions. I have never seen a nursing exams without these questions. In every exams, definitely the questions will come in from the ABC analysis. What is the metabolic acidosis? What is the respiratory acidosis? And they will give a value to you people, and they will ask for which one is this. Okay, what actually acid balance imbalance happened here, they will ask here from the ABC analysis. Most important. And in the last Norcet itself, they have asked about the Allen's test. Before going to the exam, ABC analysis, we have to do the Allen's test. So regarding that, they have asked the question. And regarding the heparinization of the syringe, most importantly, they have asked the question. Okay, and interpretation of the ABG. Interpretation of the ABG. They have asked the questions repeatedly, but it's very important. ABG. Okay, so then comes to the hospital acquired infections. In the hospital acquired infection, must revise ventilator associated pneumonia and its care bundle. And central line associated bloodstream infections, club C, must revise. Catheter associated urinary tract infections, Cauchy, must revise. So one more is the surgical site infections. So here the club C, Cauchy, WAP, and SSRI. From this, one question will fix. Definitely questions will come from this board. So don't neglect these questions. Please revise all hospital acquired infections because it is very important for you. Let me take a new board here. Okay. Then next one we have to must revise one topic is that's blood transfusion. Important, especially reactions and nursing responsibility and priority actions. Priority actions, very important. Okay, so this is very important. Then after that, we have to go for the important positions. All positions you people should have in your tip of the tongue. Okay, so tip of the tongue you people must have the positions here where we have to give the supine positions. Okay, what is the position in the tracheostomy? What is the position in the other procedures? We have to must revise this ones, all important positions. Okay, this one, this blood transfusion related notes, position related notes, and all other nursing procedure related notes already in free of cost we have uploaded in our app. So if you want, so you can refer also. The app link I have given in the description box, so do please download the app and get the benefit from the free content which is there in our app also. Okay, so the next one is the drug calculation. Fix one question. Drug calculation. Okay, here especially IV fluid calculation. That is the rate of the IV fluid per minute And most importantly, the insulin dose calculation. This is the trending question. Insulin dose calculation. So this is also important. Okay. So then comes to the needle stick injury. Okay. Needle stick injury. This is also most important for your. Just try to revise the things from the needle stick injuries, that is pre-exposure prophylaxis, sorry, post-exposure prophylaxis. Okay. So post-exposure prophylaxis is most important in the needle stick injury. Revise that one. So it's important. Then comes to the pharmacology. From the pharmacology, just we have to revise these things which I am writing here. Okay. From the pharmacology. All emergency medicines. All means not all. Just revise these things. Emergency medicines. In this one, adrenaline, narad, noradrenaline, we can say. Then atropine, then dobutamine. If you don't want, means just revise these two things. Noradrenaline, sorry, adrenaline and atropine. Most importantly, the adrenaline must revise. Definitely one questions will strike. Okay, so that is important. Okay, next comes with the diuretics. Fix on question. Fix. Then from the digoxin. Fix on question. Okay, so then heparin and warfarin. From the heparin and warfarin and from the diuretics, digoxin. So please fix one question will come from all of this. So please revise this one. Definitely the questions will strike. And the most hardest one is the never missing topic which will be striking in all exams. That is the anti-TB drugs, especially side effect of the anti-TB drugs, where the red color urine, peripheral neuropathy, eighth cranial nerve damage, which drugs are responsible. So must revise and hot topic, that is the anti-TB drugs. From here only the question will strike, right? So then comes to the updates. Updates in the pharmacology, okay? Like the dose of the atropine changed. So previously in the bradycardia, so we used to use 0.5 ml. Maximum dose is 6 doses. Now it's changed. Now 1 ml or 1 mg. Maximum dose is 3 doses. Like this is the update, right? So previously we used to give the mefiridine in the pancreatitis patient. So again we are coming to the morphine as a drug of choice in the pancreatic patient. So these kind of the updates. Don't worry, I will take one particular class on the updates. So that will help you all. So just before going to the exams, I will show you updates. And never missing topic again, the MgSO4, the magnesium sulfate injection for eclampsia. Again the hot topic. Okay, so they will ask the two regimens here. One is the Pritchard, and one is the Jupsin regimen. Previously they used to ask for the Pritchard regimen, but in the last exam they have asked for the Jupsin regimen. So please both just have a glance on that one. So it will give a clear idea to whether to select or not to select the answer in the exams. Okay, so that is important. So next comes to the pediatric nursing. Please wait for a second. So, okay, next comes to the pediatric nursing. Some from the pediatric nursing, the must revise topic should be this one. From the pediatrics nursing, so the must revising topic should be neonatal vitals and Apgar score, important one, and neonatal vitals, important one. So next come to the never missing topic in all exam, neonatal resuscitation. Okay. So then comes to the never missing again, congenital heart diseases. If you don't want to study all, at least study one thing, that is the uh, our tetralogy of phallates. So this is at least you have to study this one. Okay, if you don't have time, so just want to revise one thing, that is you have to revise the tetralogy of the palate, and its most important congenital heart disease and neonatal resuscitation must revise. Okay, so then comes to the breastfeeding. 1000 star important. Breastfeeding, the examiner will ask the questions from the techniques and duration and physiology, like how the breast milk will produce, okay, how the breast milk will eject out. So those kind of the questions, and most importantly, the latch. And in this one, again, the questions they will comes from the position, like sign of the good attachment, sign of the good attachment, and sign of good position during the breastfeeding. Okay, so these questions will definitely strike on the breastfeeding. Okay, so signs of good attachment must revise, then signs of the good position must revise, and latch. Breastfeeding is the 1000 star questions. Definitely the questions will come from here, but you don't neglect the breastfeeding topic. Okay, so then comes to the in every exam, the examiner is asking IMNCA guidelines. Okay, so here especially focused on the diarrhea and pneumonia. So what is the severe signs of the or danger signs of the pneumonia? What is the danger sign of the diarrhea? Here, the repeatedly questions coming from the diarrhea, that is from the some dehydration. Okay, so no dehydration and severe dehydration. No dehydration, some dehydration, and severe dehydration. Here, from the IMNCA guidelines, repeatedly asking the questions, and there may be chance of asking the questions of the no dehydration, some dehydration, and uh, like severe dehydration. This one, our Raghav sir already made a class on the IMNCA guidelines. Completely, sir, have discussed the color coding of the IMNCA. Okay, so there are the three colors like pink, yellow, and green. Okay, so what it indicates, what is the uh, what we can say dangerous one, what home care. So here we have to treat on OPD basis. So those are color coding also. Sir have discussed in detail in clearly. Okay. So this is also most hard topic. That's the IMNCA. So don't miss that one. Okay. So next one is the neonatal jaundice. Neonatal jaundice must revise. Must revise the physiological jaundice, pathological jaundice. Okay, the difference and the management, especially on the phototherapy and exchange blood transfusion. So these two things are going to matter a lot. Okay. So then next one, the questions may come on the vitamin K. Many times the questions asked about the vitamin K. Okay. So what is the purpose of the vitamin K? Why we have to give the vitamin K? Needed to give needle size to give the vitamin K, dose of the vitamin K based on the weight. So repeatedly ask for questions from the vitamin K. Okay, this one also may strike in the exam. So next one, note down this congenital syndromes where the one questions will come definitely. Congenital syndromes. So there are 1,000+ syndromes are there, sir. What all things we have to revise? So these revise please these four things. That one is the congenital rubella syndrome. Congenital rubella syndrome. Then the next one is congenital syphilis and fetal Hayden twine syndrome, and most importantly, yes, congenital rubella done, congenital syphilis done, fetal Hayden twine syndrome done, and most importantly, yes, congenital cataract also. Congenital cataract, just the clinical pictures only need to revise this one. Congenital cataract, because it is in the recent exams, some medical exams, the repeated questions coming from the congenital cataract. So I'm mentioning the extra one, there is the congenital cataract. So otherwise, you people must and should revise this congenital rubella syndrome, congenital syphilis, and congenital fetal Hayden syndrome. Okay, most important one. Okay, so this is the important things from the pediatric, and from the system wise, I will tell GI tract. We have to study for the cleft lip and cleft palate, then tracheoesophageal fistula. Most importantly, then respiratory. Just revise the crow and respiratory distress syndrome. 1,000% is important. Respiratory distress syndrome scales. Two scales are there, down scale, and one more is, yes, both those two scales also need to revise here. Very importantly in the RDS. Okay, so then comes to the epiglottitis. Revise these three things. That is more than enough. From the respiratory, child respiratory, I am telling. Okay, so in the adult respiratory, I will tell the so somewhat other important points. Okay, so then comes to the urinary problem. Here you have to revise the again three things. That is the extropy of the bladder, extropy of bladder, then epispadiasis, hypospadiasis. Just study the definition and the surgical treatment. So that is important here. The surgical treatment names and the definition of these all three, and is the nursing management in the extropy of the bladder, that is how to cover the exposed bladder. So that one also is important, and if possible, study phimosis also. Phimosis and paraphimosis. Just definitions I am telling here. Okay. So next one is the neuro childhood neurology. Here you have to must and should revise the neural tube defect. Here the spina bifida and yes, hydrocephalus. Is these two things are very important: neural tube defect and hydrocephalus. Here all type of this spina bifida have to revise in the neural tube defect. Okay, so very important. So the next one is integumentary system. This is skin disorders. Image based questions. Bacho, what is the impatigo image based questions? Very important. Fixed one questions will come from the image based questions of the skin disorder of the child. Okay, so then low birth weight baby and its classification and its management. Very important. Okay. So, and in every last three Norcet exams, there is one questions on the holiday and Sagar formula. Holiday and Sagar formula for the fluid calculation in the pediatrics. In the fluid calculation, it's important, bacho. Must revise holiday and Sagar formula. Okay, and image-based questions from the skin disorders and low birth weight. Okay, important. Then comes to the research. From the research, just terminology, very importantly, how to revise, especially what is type 1 error, type 2 error, hypothesis, okay, assumption, sampling, sample technique. So these just terminologies and its overview, how to know about the research, that is more than enough for the knowledge. Okay. So then comes to the microbiology. From the microbiology, just how to revise disinfection and sterilization. Very importantly, here we have to study the hot air oven and autoclave. So that is important. Okay. So then infection and its chain. Infection and chain of infection. Most important from the microbiology. Every time the questions will coming from there, right? So the next one is OBG. From the OBG, we have to revise must and should labor and all three phases and management of the labor, then postpartum hemorrhage, then pregnancy induced hypertension, here MGS4 again I am telling, and labetalol. So as the MGS4 in the eclampsia and preeclampsia and pregnancy induced hypertension, labetalol and its dose, most important, and recent trending question on the Lakshya program. This is the most trending program, that is the Lakshya program. Labor room quality important initiative program. So this is the labor room quality important initiative program, Lakshya program. The questions will again strike from here. Revise this one without wasting the any times. Okay. So then manuals, OBG manuals, already we have discussed and covered this one. Okay. So definitely one questions will strike from here, from the OBG manuals. Okay. So then comes to the bacterial vaginosis. Inflammatory, sorry, PID, pelvic inflammatory disease plus vaginitis. In the vaginitis, bacterial vaginitis, the candida vaginitis, and trichomonia vaginitis. There is the bacterial vaginitis, or sorry, bacterial vaginosis we can say. Then trichomonia vaginalis. Then comes to the candida vaginalis. So all these three important. Definitely one question will strike again from here. Okay. Here especially the secretion which is coming from the vagina and that characteristics and clinical features. The examiner will repeatedly throw a question from here, so it's important. Then comes to the non-stress test, NST and biophysical score. From this one, repeatedly questions coming as an image-based question from the strip. Okay, from the strip. So in examiner, the examiner is showing the strips. He is asking whether it is a late deceleration, early deceleration. Okay, what is the acceleration? So that kind of the questions which are coming. So these all questions we are repeatedly putting in our test series. So we are repeatedly practicing our questions on the vaginitis. All questions you people have discussed. Okay, all people you people have attended, and all you are completely ready for the exams. Okay, so because we are adding those questions that will strikes in the exam repeatedly, right? So all are my students who are attending the test series on the daily basis, all you people are completely ready for the exam. Just the exam date is about to come, and you people are about to get your ranks. So that is going to happen in a very soon. So be connected. So stay connected and stay motivated. Keep learning the new things. Okay, so that will be helpful for you all. Okay. So next one is the most important questions, which is repeatedly coming. That's the grades of uterine prolapse. Okay, so from here also question is coming repeatedly. So then comes to the oxytocin. Never ever avoid this oxytocin. Questions will strike from this one. Okay, so then PPH I have told the postpartum hemorrhage. Okay, here also we can write as a oxytocin and methoxin in the management of the PPH. Repeatedly asked the question. Okay, so then comes to the our community health nursing. Here we have to completely revise the immunization schedule. Okay, immunization schedule. Then we have to completely revise the TB types. Okay, tuberculosis skin test, interpretation, clinical manifestation, and associated infections. So that is most commonly TB. Must revise. Immunization schedule must revise. Okay. So then comes to the epidemiology and demography terminologies like the point prevalence, periodic prevalence, incidence. So this is epidemiology and demography. Just terminology superficially you people have to study here. Okay, so that is important. So then comes to the very important hot topic, that is anemia mukt bharat. Anemia mukt bharat program, very important. So must revise. Okay, so then comes to the level of prevention. Level of prevention, there is no any nursing exams without this question. Okay, so in all nursing exams there is question from the level of prevention, right? So then comes to the family planning, hot topic. Family planning, and next one is the communicable diseases. Just you have to study the classical features of the communicable diseases. Communicable diseases like you are studying like measles. Just revise what is the most common complication, what is the most common reason, what is the most common uh, area from where the rashes will start. Okay, so and classical picture as a complex spots. So this only the classical points you have to revise about the communicable disease. Only that thing will ask in the exams. Okay, nothing extra. Then comes to the malnutrition. Here the protein energy malnutrition. This one it will comes in pediatric also in community also. So wherever you want you can revise. Okay. So micronutrients and macronutrients malnutrition. So that is important from the community side, right? So these are the hot topics from the community. So then comes to the very important topic, that is from the medical surgical nursing. Almost we have completed. So the last thing, that is the medical surgical nursing. The it is like a very huge syllabus in the medical surgical nursing. So just to cover your all important and high yield topics in a very short manner. So just I will tell the important thing from the medical surgical nursing cardiac system. From the cardiac system, all you have to know the basic definitions. That is what is the mean arterial pressure, what is the pulse pressure, what is the pulse deficit. Okay, so then comes to the what is the jugular venous pressure. So this is as a basic all people have to know. When it comes to the our disease conditions, here two things: myocardial infarction and congestive cardiac failure. Completely need to revise and study these two things because the questions will strike from here, right? So then the next hot and hottest one is the ECG. Just revise my classes. That's more than enough for everyone. Okay, from the ECG, right? So the scenario based questions, IBQs, and the practical based questions from the ECG. Everything I have discussed in the class. So do revise that one. So then comes to the eye disorders. Two things I will tell from the eye disorders. One is glaucoma, especially medications of the glaucoma. Then comes to the cataract. Must revise the glaucoma. Glaucoma is the must revision. Okay, so that is very important. Then comes to the neuro part. From the neuro, again the cranial nerve examination and scale. That is the glaucoma scale is most important. When it comes to the disease conditions here, the head injury, fixed one question will come from the spinal cord injury. Fixed one question will come, and most importantly from the meningitis. From the meningitis, the question will come from here also. Okay, so it's important. Compulsory how to revise this one. So as the extra, revise the Parkinsonism also. This times. Okay, it's important, bacha. Spinal cord injury, head injury. So you want to revise only two things. Just revise the head injury and meningitis. From the spinal cord injury, autonomic dysreflexia is the thing. All you people have to revise. At least revise these things. Okay. So then comes to the respiratory. In the respiratory, most importantly, COPD, asthma. Okay. So then comes to the pneumonia. Must revise the COPD. Okay. And pneumonia. Next comes to the hemat. Anemia is must revision. Definitely questions will come from the anemia. Bacho, please revise the anemia. Especially iron deficiency anemia is very, very important. Okay. So next comes to the onco. Oncology is a study of the cancer. Here, the all tumor markers. All tumor markers. Along with that, breast cancer and cervical cancer. Most important from the onco. Tumor markers, breast cancer, cervical cancer. Okay. So then it comes to the renal system. Must revision in the CKD and AKI. There is a chronic kidney disease, acute kidney injury. So then comes to the nephrotic syndrome. Nephrotic syndrome, most important. Okay. From the skeletal system, osteoporosis, then arthritis. In the arthritis, especially gouty arthritis, most important. Okay, osteoarthritis and rheumatoid arthritis are also important, but gouty arthritis is the most important. And the classical clinical manifestations from the osteoarthritis and rheumatoid arthritis, gouty arthritis, just classical clinical pictures the people have to remember from here. Okay, so that is important. So all possible questions from the every subject we have discussed. Okay, so and okay, let me take just two more topics. Just I'm highlighting the important one. So this is most important one, right? The topics comes on GS system, a huge syllabus is there from the GS system. So must revision one will be inflammatory bowel diseases, and after that peptic ulcer must revision. So then liver cirrhosis, liver cirrhosis must revision. Then hepatitis. So these are most important. Two highlighted one. IBDs and liver cirrhosis. There is chance of coming in this particular next exams. Then comes to the burns. Integumentary burns must revise, especially the formulas of the fluid calculation. Formula of the fluid calculation is must revise. Okay, and degree of the burns is very important. Okay, so then in the endocrine system, thyroid disorders, both hypo and hyperthyroidism, important. Okay, so then Cushing syndrome. These are the must revision topic. So this is very much helpful for the students who are looking for the to crack their exams in a short period of the time. Okay, so I told these are the important topics. Means many of you are freshers and want to attempt the exams as a first time and with a short duration of the time. So you want to cover all important topics. So if you know this all important topic means, then it is helpful. Okay, so that is the reason I have given you a clear idea about the important topics. Okay, so where you people have to revise these particular topics as a must and should, who all are preparing from the initiation and who all are as a students and preparing for the exams. So don't go only for the important topics, because this brings you around 50 to 60 marks in the exams, and the rank deciding one will be whom. So who all are doing the all the syllabus and covering the all the syllabus, right? So this is for those students who all are having the very short period of the time to study. So now they want to revise the important things. So for them I have given a clear idea what all are the important and from where the questions are striking based on the previous year question paper analysis. So if video is helpful for you all, so please do hit the like button, and for covering all the important question papers and what are the important topics I have told today. From these, the questions will strike. So, what are the questions? Which scenario based the questions? What are the one-liner questions? Important questions. So, those questions based on the complete plan of the important topics we have kept for the mains exam, and we have kept for the prelims exam also just before the exams. So, what are the questions we have discussed since from the first day to here is the basic to advanced questions and with important questions. So from today onwards, what people are going to practice are the very important questions that will strike in the exams, right? So I hope this video will be helpful for you. And if you are watching a master nursing classes first time, so please do hit the like button and subscribe button. So all of the notification which is coming for your nursing exam related, so that will comes to you very easily, right? So without wasting the time, we'll close the things because the most important points we have, you people got just the now you have to revise the times these particular topics 10 times 10 times, okay? So as much as possible, so just try to revise that these topics because this is going to helpful for you all, okay? So we'll wind up the particular class now and we'll meet in the next session. I will try to cover the all important topics from my side also, so please stay connected and do watch the video which are posting on the YouTube. So I am getting the all updates and bringing in front of you people in a free of cost. So please take a use of that one. So that will be helpful for everyone in the upcoming exams. Okay. So I'm repeating again whatever the must revision and important topics I told here. This is for those candidates who want to revise the all the syllabus important syllabus for the exams. This is for not of students in a second year, third year who are preparing for the exams. So for those students, if you prepare from the very basic to till the advanced, so master nursing classes is always with you to guide and help you. And this is for those students who are again repeating, who all are wants to cover the important syllabus for the exams. Okay. So I hope the situation and the class is understandable for you all. And don't waste your time. So keep preparing. All the best for your exams.